See, I remember to press record. So there we go.
Congratulations.
Welcome to the grind. I'm Mike. Who is with me? Who's with me? Who is you?
Hi, I'm Christina.
Yes, Christina, our ACA expert, and me, the secondary at everything, is here today to talk about MA to Sup. And you're like, why would someone on a supplement go to an MA plan? Good question. We're going to talk about that. But before we jump in there, few things to remember. This week we have on Thursday, we're doing a hospital indemnity training at 11 o'clock on Thursday. This webinar is very much how to. How do I bring up hospital indemnity at an appointment? We're going to tell you how. At 2 o'clock, there's an ACA webinar with, again, JC, who is the ACA guru at AmeriLife, and Christina will be doing a webinar at 2 o'clock. Both these times are Eastern, going over the ACA market as a whole. If you are a senior market agent, it's worth your time having ACA in your back pocket for the times that you come across an individual and their spouse or significant other isn't of age yet, but they're going to lose their coverage because their partner is going on Medicare and retiring. So you want to be able to at least give them some options on the ACA side, whether it be a short-term care plan, a true ACA plan, or anything in between. They're going to talk about that this Thursday. So put yourself in a position to say yes to business and situations that may arise very likely in your career. And that's what Thursday is all about. Hospital indemnity and ACA. So if you're like, I need to sell more stuff, we got you. Right, Christina?
Absolutely. And this ACA training is for all. So if you're already selling it, it's going to have updates for the next year, tips on how to continue selling it. If you're new to it, it'll also help you get started in the ACA world. So definitely going to be a
Yeah.
good training.
Yeah.
Expensive.
And absolutely. So yeah, go to gordonmarketing.com as you can see in the corner up there or there, wherever I am on your screen, or maybe it's down there. I don't know, wherever it is. Gordonmarketing.com. You're going to click on calendar and then look at this week. And again, 11 o'clock HIP, 2 o'clock ACA. We also have a 2 o'clock Ethos training. So if you have our Ethos platform with us, you're like, I need to start selling this. That's also at 2 o'clock. So get your pick this week, ACA or Ethos. Just a reminder, Ethos is every week. Intro on Tuesday, how to do it on Thursday. So that's every week. So if you're like, I don't know which one to go to, you always catch Ethos the following week. You can't, this ACA one's a one and done, but we are going to record it, I do believe. So that we will have access to the recording. So again, go to marketing.com, click on calendar, and then click on the event you want, and there'll be a sign up form there. And I'll make sure to send these out in the post email as well. Two more Top Golf events for the year. One today that I'm guessing you're not at in Detroit, and one more in Cincinnati, which will be next week. Myself and Aaron will be there. No, I'm sorry, in 2 weeks. So myself and Aaron will be there last week of this month in Westchester, Ohio. Yes, I hear that's the Las Vegas of the Midwest. Said nobody. All right. Some updates. We got to make sure you're ready to sell this upcoming year. So the carriers have released, at least a lot of them have released their certification dates, which you can see on the screen. Aetna, Devoted are coming up pretty quickly on the 23rd, and I won't go through the list. You can see the list, but there's everyone, what they're doing coming up. So if you're like, when can I certify? There you go. I don't know if this still reigns true. So correct me if I'm wrong, all my people on here. I used to always say, when you see certifications open up, wait a week, right? Because that's when they get the glitches out, the bugs out, make sure everything's okay. So if you see, for example, Humana is coming up on July 8th, and you're like, well, I need to do that. Maybe wait till July, and say maybe 15th the next week or whenever it is, just to make sure that everything's smooth sailing. So that's what I recommend. But again, do it sooner than later because the longer you wait, the harder it's going to be to balance everything out between ordering supplies, going to roll-up meetings, taking care of your clients, and then you have to do this. So right now it's a little more quiet. Perfect time to knock out those certifications. And remember, some carriers, if you're not contracted with them yet, let us know. We'll get you contracted. And if you certify after that release date, a lot of them will let you sell this year and next year. Not all of them. Depends on the carrier, and we could cover that with you. I'm not going to go through that today because it gets very convoluted very quickly, but you can give us a call here at Gordon Marketing, and we'll guide you through the process. If you have to do it once, do it twice, and so on. Because we're fielding a lot of calls of agents going, well, I need it certified. And we're like, well, wait, well, I know you want to sell now. Unless you want to do certifications twice back to back, that's fine, especially if you have a pending client. But if you could wait a little bit, you only have, a lot of times you only have to do it once, which saves you a lot of time and energy. All right. So, what are we seeing in the med sup market? Glad you asked, right? Prices, no surprise, have skyrocketed. It used to be the average rate increase was 5 to 8%. We're seeing a lot bigger rate increases. So, it's getting to the point, and this is what I'm reading on a lot of forums. We're hearing talking to agents, going these top golfs is look, I as an agent, I'm primarily selling med sup. That's what I prefer. That's what I have. Yada yada yada. But then what happens is the price gets too high. So it's like, okay, what do I do? I'm starting to strain my finances by paying for this supplement each and every month. What now? Glad you asked. This is what we're seeing. Again, the average rate increase 10 to 15% in 2025. However, some markets had 20 to 26%. And what that does, if you go the median there roughly, a med sup could be 243 this year or all the way up to 266 or higher because what happens? Well, they start getting very expensive and I can't afford it. When I bought the med sup a handful of years ago, I was around $200. Now I'm almost $300. And then you add my PDP on top of that, and I'm past $300. So it's becoming more harm than good paying that monthly premium. What do I do? Well, let's look. Because as you can see, the average med sup is 217 in that graphic, according to Kaiser Family Foundation. If you're not familiar with that website, phenomenal website for stats, figures, industry updates. I use it all the time. I steal this stuff left and right, but you can feel free to check it out on your own. So it's not me making up numbers. This has been true and tried, and your clients may be feeling that sting with those rate increases. The other side, and I think we've talked about this before, we're going to talk about it again all the way to AEP. The change rate has skyrocketed. As you can see on that chart from Deft Research, the highest change we had with Medicare Advantage, the blue line was 23% in 2015. Last year, we were at 19%, trending up for the last few years. So as you see in 2022, we had 12%, then 15, then 16, then jump up to 19. What will it be next year? We don't know. But with the higher rate increases of med sups and a lot of Medicare Advantage plans reducing their service area reductions, getting out of markets, maybe getting more expensive and copays and coinsurance, we're probably going to see a lot more change. If you don't believe me, look at the next stats. We have 42% of people 2 years ago shopped around. Last year's 62%. So you figure 6 out of every 10 of your clients are at least paying a little more attention to ads, right? Especially in AEP when you can't turn the TV or open the newspaper or listen to, anything online without seeing some sort of AEP solicitation. So people are paying more attention to that, especially since they're being strained all over. Gas pump, groceries, medical costs, everything else in the world. And because of that, again, we've talked about this before, but super important to remember, 17% of Medicare beneficiaries have delayed procedures. 13% have skipped doctor visits. 12% have ration medications. It's becoming worse. So I think it's better for you as the agent to not ignore this, but address it with your clients. And some will be too proud to admit it, and that's okay. But the fact you're bringing this stuff up and seeing if they're being affected in any way, shape, or form shows that, hey, I'm looking out for you. But one thing we've always said in this business, if you've never heard it, now you're hearing it. If you can't afford a med sup, you can't afford to get sick in a Medicare Advantage plan, right? I can't afford $1,000, so I can't pay $200 a month or $250 a month because that adds up to $1,000 after a few months. Well, if you go to the hospital on a Med Advantage plan, it's easily $1,000, right? $350 a day, you stay there 3 days, you're over $1,000. So again, you can't afford a med sup, you can't afford to get sick on a Med Advantage plan. And that is until you add a hospital indemnity. Because when you add a hospital indemnity plan, a lot of these things falter. The reason I'm bringing this up is if you have someone coming off a med sup and they're like, well, now what? I don't want to pay all these copays. I don't want all these extra expenses. What can happen? You're kind of creating a hybrid option with your clients, right? You're eliminating all the major copays. Now, they still have a network. Of course, that's important to check that their providers, their doctors, the people they want to use for the healthcare are still a network. That's obviously very important. And they have flexibility to change annually, but they can keep that copay coverage, i.e., the hospital indemnity plan. So, at what point, and this is a conversation I think it's be much more relevant in today's market is okay, your new premium is X amount of dollars, 250 a month, plus your, $30 a month for your PDP plan. So now you're at 280 a month. Is that becoming a strain on your finances? And if it is, you don't have to pay all these copays. There is an option to cover those. And that's hospital indemnity. And the fact that they can, once they get that plan, it sticks, they can keep it forever. It's a very, very good way to alleviate a lot of their concerns. And again, if they don't like the MA plan they're on, they do have, I'm going to go back one more. They do have that test drive. So don't forget. And this is from the Medicare New Book. If it's their first enrollment into a Medicare Advantage plan, they have that 12-month trial right. I call it a test drive to see if they like the plan. And they can go back to their MedSup if they still sell it, or they could pick another plan in the market. However, with hospital indemnity, one second. There we go. Mid-year touch point. This is a great time to remind your clients, hey, I'm here, and give them a heads up. You know what? What we're seeing in the market is the potential of higher copays next year. And you know what? I don't want to pay higher copays. I don't think any of my clients do, or maybe you don't. So we have this copay solution option, or whatever you want to call it. And that will actually take care of your hospitalization, your ER, your ambulance, your outpatient, your pet boarding. Yeah, you list off the benefits, and it's like $45 a month. So it's not a full-blown sup. It's not all the chaos of all these copays with Med Advantage. It's a happy median, right? And here's the kicker. If they purchase it now, what happens? In 2027, they're past the pre-X. So every hospital indemnity plan comes with a 6-month pre-X. Now, for any new diagnosis or injury, they're covered, right? Because it's a new diagnosis, wasn't pre-existing. If it's an accident, it's immediate. But if they already have a pre-existing condition, guess what? They can't, they have no coverage. So especially in 2027, if they're going to pay more for their copays, what happens? They're going to pay more, right? That's going to be further strain on their finances. But if you offer it now, one, if they do go shopping in AEP, like we looked at, 62% of seniors were kicking the tires last AEP. If that happens again, you want to make sure they kick the tires with you in the passenger seats, not with somebody else, not on their own, calling an 800 number, clicking a link on their social media, because as soon as they Google Medicare, what happens? Medicare advertisements on their Facebook, their Instagram. If they're on Snapchat, they open their email. There's a Medicare ad, right? So Google or whatever search engine provider they use is going to start blasting them with Medicare ads. You want to make sure when they see those, they think of you, their agent. Oh yeah, my agent got me that extra protection. I need to call them before I switch to make sure I don't mess it up. So you're going to be right there with them shopping. And that preserves your book of business. If you don't do a mid-year touch point and don't offer hospital indemnity, you're giving them permission to look on their own because they haven't heard from you. Why would they go back to you, right? And so if you think you have this great relationship with your clients and you don't talk to them ever, it may not be as great as you think. I compare it to dating. Not the greatest example, I'll admit, but think about it. If you go on a date with somebody, right? Oh, my screen just froze. So you go on a date with somebody, and it's a good date. You have a good time, good dinner, great conversation. Everything's hunky-dory. And then you don't talk to them. You don't call them back for 11 months. And you call them back, hey, what's up, girlfriend? How are you? They're like, who are you again? We talked 11 months ago. We're not in a relationship. I haven't heard from you, right? They would think you're crazy. And your clients may be thinking the same thing, right? Yes, we had a pleasant 45-minute conversation about Medicare, which of course was very riveting, but I haven't heard from you for 11 months. So there is no relationship on my end with you. You may think you have one, but I don't have one with you. So you have to be talking to your clients, whether it be an email, which is, of course, phone call or text message, if you have permission to text, is much more personalized, but at least a monthly newsletter, social media, whatever it is, to make sure you're staying in front of your book of business. Because again, everyone else is. But as soon as you lay that hospital indemnity plan with them, now you're really giving them some stickiness to make sure they stick with you as their clients. So there you go. And then again, Rick says, I steal clients from other agents by selling Plan N, right? If you're not offering Plan N, huge missed opportunity there. Great point, Rick. That's an excellent point. So, got to tell them on test drive if they're hesitant. That's okay. Not everyone will switch, but at least they know when that premium gets too expensive for them, you gave them an option. So you will likely get that phone call. Hey, Christina, you were out here a few months ago talking about this other option, and I just got my rate increase, and yeah, it's more than I thought it'd be. So tell me about that option again. Now they're shopping with you and not calling a random 800 number. So if you don't create the stickiness, it doesn't exist. Okay. Now, if you're like, I don't like this option, right? I don't like Medicare Advantage. I don't want to mess with it. It's dumb. I don't get it. I would never have it for myself. Again, your clients may not have a choice. You don't want to say, well, I don't like Medicare Advantage, so stick with your Med Supp, and now you're creating financial strain for them. So you need to be flexible with them. It may not be the best solution for them, maybe medically, because maybe they have to change doctors. But again, if they go broke on the plan, that doesn't help them either. So just be considerate, right? Roughly 55% of people are on Medicare Advantage. It's not going anywhere. And again, if they have never been on it, you still have that test drive option to help alleviate some strain. If they don't have it, explain it to them. Say, here's what happens if you change, yada, 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 yada. We can add this copay protection to eliminate a lot of stuff so we can make it as close as we can to a Med Supp with the network, but we're going to greatly limit your out-of-pocket costs, right? That's a lot easier decision than going, oh, I got all these copays and have a network. Yeah, it's zero premium, but if I get sick, I'm SOL. Well, guess what? Now they're not. So if you can make it easier for them and give them solutions, even if they don't take them, they know they could turn to you later on. So you don't have to like it to offer it. Just like I know a lot of agents, like Rick, hate dental insurance, but guess what? Some people want to chew their food and they think they need dental insurance to do so. So unless you want to start selling blenders to your clients, let them know that dental exists, okay? Now, again, we talked about earlier about these webinars coming up. So, you've got me on the screen as the young man, and then you got Ethan Hawke, and you got Denzel Washington, Christina, because she's the evil one here. So, because she's pretty ruthless. I've worked with her enough to know that she would easily just leave me on the side of the road to whatever. I'm just kidding. Love Christina. But no, she's doing the ACA at 2 o'clock this Thursday. So Thursday is training day. ACA market 2 o'clock. Again, if you say I don't do ACA, you may have an opportunity to help a client with ACA. And I would say get certified, whatever you need to do with ACA, and have it in your back pocket. If it does come up, you can say, hey, you know what? I don't do a lot of underage insurance, underage being under 65, but the company I work with does. Let me give them a call, get some options for you. That's a lot better than saying, I don't do that, call somebody else. And then you call Christina and you say, Christina, hey, you know what? Or Gordon Marketing, they'll get you a hold of her. Say, hey, I got this client, wife 62, husband 62. They want to retire. What options do they have to live in this state? We can give you a whole list of what's available. And then you go present it. Hey, my back office sent me some information. Here are your options. So either you're going to work longer and stay on group insurance, or you can retire, and this is what your coverage will look like. So there you go. And again, that's far better than I don't do that. Go away. Horrible advice.
And I did put the link in the chat because somebody
Oh,
asked for
thank
it.
you. See, this
Yeah.
is why she's here, because she's far better than me. Did you put it to everybody or just yourself?
Everybody.
Oh, you did host and panelists.
Yes, that's
No, you got to do
everybody.
everybody. You got dropped on to everybody. You said the
That is
host.
everybody. We've already had this discussion.
Oh, we did. I'm sorry. I have the fact I'm allowed to talk to the public is a small mystery, right? But 11 o'clock, 8, we do the HIP again. So hospital indemnity. If you're like, what do I say to bring up hospital indemnity and not sound like I'm trying to force product on my client's throat? That's what we're doing 11 o'clock on Wednesday. Now, here's the kicker. If you can't attend, still register because we're going to send out all the post materials. We'll send a link to the recording, any resources we talk about. We'll send in the post email. So you're like, I can't make either of those because I have a life. Good for you, but still register if you can attend to get the post email. So again, if you don't see the link, you can go, or afterwards, you're like, man, I forgot to click that link. GordonMarketing.com, click on calendar. It's all there. It'll also be in the post email I send out probably tomorrow morning. I have to do some recordings. If you haven't seen, we have a new series called The Ask on our YouTube channel. It's me and Steve and our annuity team doing some annuity stuff. So that is coming, but we have to do some more recordings. So more episodes are coming. Go check it out on YouTube. It's fantastic. I mean, you like, did Michael Bay direct this? This is amazing. Just kidding. No one has, but check that out. All right. Again, the free download, the biggest thing to get a client from I don't know to yes is familiarity. Familiarity equals trust, trust equals sales. Also, naming it normalizes it, right? So if you give something a name, it becomes normal, right? I have a hospital indemnity plan we're going to add to your coverage. I've never heard of hospital indemnity. What is it? I'm scared to say yes. I don't want to do it because I'm unfamiliar with it. Hey, I have this 360 protection wrap that we're going to add to this. And I do it with a lot of my clients, to help make sure that they're not, if they get sick or ill or something happens, that their copays are pretty much taken care of. Ooh, 360 wrap. I don't know what it is, but the fact that it has a name makes me more comfortable. So if you go to MedicareGrind.com, click on library, you can download this sheet. Again, this is AI doing it. Some of these suggestions are blah, but at least give you some inspiration to create your own. Like, you could just call it, instead of the 360 protection wrap, you can call it the wrap, or you can call it the protection bundle, or you can call it this, like the senior safety net, or the deductible buffer. I don't think I would ever call it that, but maybe you call it something similar to that. So these are just some I would say idea generators. Or you may find someone that you like, an out-of-pocket safeguard. That's not a bad one. Yeah, it was out-of-pocket safeguard that basically takes your inpatient costs, your outpatient costs, some other hospitalization costs, some medical costs, and we get as close to zero as we can. So if you go to the hospital, you get billed for $1,500, but you also get a check to pay for that for $1,500, essentially making it zero. Oh, I like zero. Zero is a lot better than $1,500. Let's talk about that. But again, the fact you named it makes it okay. I feel more comfortable moving forward because if it has a name, that means you offer it to a lot of people. It makes me feel more comfortable. So just a little, again, it's not a trick. It's just normalizing what you're doing to people that don't understand what the heck you do. I mean, you sell insurance, but no one knows how Medicare works. So what are we doing here? Premiums are getting higher. Be ready for the pivot. It's okay to offer them options, even if they don't take them, because again, if they get a big rate increase after they talk to you, now they know they can call you back and say, what the heck, right? Offer hospital indemnity now. Beat the 6-month pre-X, especially if we think, like the rest of the market, that the copays and costs are going to rise in 2027. So my prediction is you're going to see just as many zero premium plans because zero premium is easy to offer, but the way they're going to offset that is higher deductibles, higher copays, higher coinsurance. So as much as they could squeeze all those copays, they will. And that means more out of pocket for your clients. So you could help offset that now, starting today with illnesses and injuries that aren't pre-existing. And then when the higher copays come, they've got 100% coverage, even for pre-existing. So talk to your clients now. Even if they say no, now on hospital indemnity, you plant that seed. So you go back to them in AEP and show them the new plan. It's like, ooh, higher costs. I was like, yeah, remember I had that hospital plan, that copay eliminator, whatever we called it, whatever it was called, copay. All right, that's going to bother me. One sec. Hold, please.
I don't remember either. Sorry.
Yes. Copay. I have one screen, so I got to move these. Copay safeguard. So I got this safeguard kit that will help protect you from all these copays. We can still add that. Okay, great. Let's do that and that. So you plant the seed, and now they're even more comfortable moving forward because they've heard of it already. Because again, familiarity equals trust, trust equals sales. And ACA, you need to have in your back pocket. right? It may not be your
Mhm.
primary market, but you're going to talk to people under 65 inevitably. And you want to put yourself in the position to say yes, not go away, or I don't care. I don't do that. I'm sorry. Or worst case scenario, but better than nothing, have another agent you could kick it to, right? I don't do that. Like I don't do underage, but my friend Christina does. I'll give you her phone number. You call her. She can explain your options to you
I'll
to
take
see if
your
you can retire.
referrals.
What's that?
So I'll take the referrals.
Yeah, see, exactly. She'll sell it for you. You'll see
Yes.
no commission, but she'll sell it for you. So if you want her to help put shoes on her child, give her some referrals. So there you go.
And the awesome thing is the FFM training doesn't have a cost right now. And then the Health Sherpa, which is your online enrollment tool, also no cost. So it doesn't cost you anything to start selling ACA, which is awesome. Unlike,
Yeah,
getting into Medicare, you're paying AHIP and everything like that. So no additional costs.
exactly. Exactly. So, let's see. So we got some chat in here. Is it better to pay copays under the Medicare Advantage plan than the high deductible Medigap monthly plan? With either plan, the hospital indemnity plan is great. Yeah. So Frank adds a good point. You could always switch them to a high deductible G, which is great. It's just a lot of agents don't sell it. And I think it's a good option, but when the market has less than 1% penetration on those plans, it just shows me that agents aren't doing it, right? So it's a good option. I'm all for it. But again, one, underwriting is a concern. And, those plans aren't guaranteed issue. So there's your first obstacle. So they may have to pivot to Medicare Advantage. But yes, hospital indemnity could work either or. Absolutely, 100%. It's just, I would say, based on the market data, most agents are likely to pivot to a Medicare Advantage plan versus a high deductible G. So, but if either one, hospital indemnity works. Hospital indemnity works regardless because it says, oh, this bill is here. We're going to pay what we pay regardless of what insurance you have. If you have veterans, group, individual, ACA coverage, because remember, a lot of these, like Mutual of Omaha, goes all the way down to 18. So 18 to 64, health questions. 64 to 74, guaranteed issue Mutual of Omaha. And that goes up to 85, I believe. Side note, don't forget, Mutual of Omaha on their hospital indemnity have the $30 per app kicker. So every hospital indemnity plan you sell with Mutual of Omaha, you get $30 bonus up to $2,000. So it's another reason to start offering it now because that goes away in September. So start offering it now. Get your clients the protection they want now because most clients don't want to lose their shirt going to the hospital or pay more than they have to, or at least they want to know their options. And if you do sell it, you get a commission plus $30. Not a bad little gig. And we'll all send out some information on that as well. So yeah, either way. And again, some clients don't want that big deduct. It's not really deductible, but if you think about it, high deductible G, all it is original Medicare with a max out of pocket. That's all high G is. It's just you add the stop loss to original Medicare. That's all it is. But some people don't like that. Some people want that copay or whatever it is because it's easier to understand. It's zero premium. Zero premium is better. Even if your high G is $40 a month, 40 for zero is easier to absorb, right? Because there's nothing to absorb. So again, if you want to give your clients both options, absolutely. It's your business, do it how you want, but that's how it works. Is the gross overfunding of MA by CMS making them so attractive that people don't realize they might get ill from the future? Yeah, it is. It's being corrected to some degree. And I compare the MA market to the mortgage market. When COVID hit, mortgage rates were 3%. Now mortgage rates are back up to 4, 5, 6, 7%, whatever it is, which look ridiculously high versus 3%. But the rates we have now are technically the norm, right? The norm for Medicare Advantage, if you go back to 2015, 2014, even 2016, you had some value add, not a lot. It wasn't uncommon to have a premium or a zero option and a premium option, right? But they became overfunded, so people got spoiled, and now it's resetting, and people are going, what the heck? So happens all the time. It's just that ridiculous cycle. Will it ever happen again? We don't know. It's unfortunately it's politically ran, so we're all in trouble. I prefer discount dental plans. Absolutely. Yeah, discount dental. Again, I always say it's not my job to sell you insurance. My job is to offer you what's available and you pick it. Here's a discount plan, how it works. Here's traditional dental, how it works. Which one you feel better buying? It's up to you, right? Right? I don't like sour cream. So I think sour cream should be illegal. But I know a lot of people like
You're
sour cream,
crazy.
so enjoy it. I don't want it. But I'm not going to complain to the menu to the server that sour cream's on the menu. So same thing here. You don't have to like it, but other people may, and they may order it. Was that a great example? Absolutely not. But they can't all be winners.
No, because sour cream is amazing. I put it on almost everything.
That's why Christiane doesn't do senior market because simpletons like sour cream. So I'm kidding. For all you like sour cream, like Mike said, what? I'm just kidding, of course. Um, there you go. So I'm scrolling through. If a client reaches their max out of pocket, it is still lower than paying 3,000, 6,000 per year for Medigap. Exactly. It used to be for a lot of times the max out of pocket on an MA plan was higher than all the premiums added up to their Med Sup. So it made sense to stay on the Med Sup if something catastrophic happens and you have all of a sudden are getting all this medical care. It made sense to stay on the Med Sup. But that market is shifting, and that's why we're talking today about people going from Med Sup to MA because now they're paying more than a max out of pocket would be for a Medicare Advantage plan, at least this year. Who knows what happens next year? I know the max out of pocket is roughly what, 9,000, 6, 7, $9,000, somewhere in there. I think it's 6,000 plus. So do most plans have a lower max out of pocket than what Medicare allows? That's true, but we may see that creeping up next year. All right. Moo has an RX rider that may almost pay the monthly premium. Exactly. So Mutual of Omaha has, I think, probably one of the most robust plans on the market because it's got a home health rider, it's got the RX rider, it's got this a good skill nursing rider, but the home health one's unique. And not a lot of plans offer the home health side. And here's a kicker, right? Mutual of Omaha, household name, right? Go in the house and say GTL. What is that? Is that some kind of car? Go in the house and say Wellaby. Well, that's a small animal in Australia, right? Go in the house and say Mutual of Omaha. Oh, yeah, that's the insurance company. So there's huge advantage of having a name people know. Because again, familiarity equals trust, trust equals sales. McKinsey, the big, consulting group, did a study. 82% of people felt better buying insurance when they knew the name of the company. 82%. Now, you as an agent can say, yeah, you never heard of Wellaby because they specialize in this coverage over here. Very popular in my market, but you coming from the group market probably never heard of it, and that's okay, right? So you have to do a little explanation. Hopefully they like you, and they're like, okay, that makes sense. But when you say Mutual of Omaha, it's like, yeah, I know them. Yeah, they had, the Wild Kingdom. They're in Omaha, obviously. I can, you show them the logo. Yep, that's Mutual of Omaha. Familiarity. When they're familiar with it, it's much easier to say yes to. So the fact they came out with a good household indemnity plan, icing on the cake, in my opinion. And you can quote it on your phone. You don't have to log in. You simply go to your app store, whether it be Apple or Google, type in quotes for professionals. I believe that's it. Look for the lion head, download it. No login required. You could price your med sup, hospital indemnity, some life products. It's all built in there. So long-term care is in there. If you want to scare your clients, go for it with those premiums. But yeah, so again, going in with a household name is always easier than going in with anyone never heard of. So there you go. Any other questions, comments, concerns, threats, or promises? Greek yogurt for the win. Ill. Bad economy, bad food. Actually, I like yours. But yeah,
Yes,
if
that
there
is a
it's so
healthier option.
you know what? I'm gonna enjoy my food. That's all I'm gonna say. Now, my better half loves Greek yogurt and loves sour cream, and I hear about it all the time. I can't stand the smell of yogurt. It's just like to me. So
Huh.
yeah, I love it. Like, next time I see him, I'm gonna have
I
like a
know. I'm
55 gallon drum of
contemplating.
yogurt, or have like yogurt scented, perfume. You'd be sitting there doing this the whole time.
Yes, I'll come up with something. My husband hates mustard. He's terrified of it. So I I really get him all the time. So.
Know who likes mustard? Satanists. Just
Oh, no,
saying.
I love
Good for
mustard.
you. Good for you for worshiping the devil. Yeah. Richard made a good point. High G for beneficiaries who are dead set against provider networks. Yeah, agree 100%. If your client, or if they use some arbitrary people, yeah, high deductible G may be the only option. I will say this. Remember, Medicare Advantage is basically group insurance for beneficiaries. If you have clients coming off group insurance, it works the same, right? Someone help pays for the premium on group, someone pays for a premium on Medicare Advantage, right? CMS.
Yes.
Annual enrollment, right? Group insurance, you have to reapply every year. Medicare Advantage, every year. Group has a network. MA has a network. Group has copays and deductibles. MA has group copays and deductibles. So if they're comfortable with their group plan, they'll probably be comfortable with an MA plan, right? So if you explain it like that, it's like, again, familiar. Oh, I'm familiar with how my group plan works. This works pretty much the same way. Yeah, basically. Okay. Now I feel comfortable saying yes. Because
Yeah.
for 40 years, I had a PPO or an HMO or some capacity. So now I feel more comfortable moving forward with this. So again, if you could frame it to where they know it, they're more likely to say yes. I
Yeah.
should write that down. I don't have any
Exactly.
paper in front of me though.
That's exactly how I used to sell it. And it made sense.
See, if Christina doesn't, it's brilliant. So
Absolutely.
yeah, she's very humble. If you haven't figured that out yet, hence she's our new host. I'm just the assistant at this point, so she's in charge.
And
Um,
so with the hip plans too, they really work well with ACA, especially if you're looking at a bronze or a catastrophic plan. So, if you already are selling ACA, you're looking to get into it, I think that hip training on Thursday is going to be amazing.
Agreed. Yeah, so definitely be there. Again, even if you can't make it, register. I always register for webinars I can't make it to because I want the post information. So I implore you, please just register to get the information. And if you have questions, you can always call us over here. So Julie made a good point. You also get paid per head on ACA policies. So up to 4 times $25 average commission is better than one Medicare client. Yes, can be, right? So if you're selling a family, it could be very beneficial. There you go. What else? By large, the major objection I get to a client going MA plan is choice. Certain people simply do not accept networks. Again, it works like their group plan. But again, if they're 100% against networks, then you can say, great. Well, the only other option is to either change to a new Medicare supplement, which involves underwriting or a guaranteed issue time, like a birthday state, or a high deductible plan. So let's lay out their options, right? And maybe if their options aren't any better, maybe they look at it. But again, if they've never had an MA plan, they have that trial right where they can go onto it for up to 12 months and go back to the original one underwriting free. So there is some leeway. Just explain it again. Your responsibility is to show your clients all their options and let them choose, right? If you hate the fact of having a network, fine. Here are your options. Different plan or different carrier, high G. How's your health? Your health is good? Great. You have options because two things buy insurance, health and wealth. Can you get it medically and can you afford it financially? Those are two things that allow people to buy health insurance in most cases, right? ACA, still, your wealth still buys it. No underwriting, but can you afford the premium, right? If you're not subsidized, it can cost more than a very nice sports car. So, yeah, I'd prefer the sports car and just hopefully go out in a blaze of glory. Hopefully, someone hits me and then their insurance has to cover my injuries. So, tell them just get a good friend to sideswipe them. I'm kidding. That's insurance fraud. Don't do that. All right. So we have a question that came in that says, how do you address the restrictions that carriers place on clients and claims in MA plan comparison to MedSup and make them feel comfortable with the MA option? We have encountered several facilities, skilled nursing in our network that do not accept MA clients. That is a huge weak point of MA is skilled nursing. Here's why. So, fun fact, I'll give you a quick history lesson on me. I sold United Healthcare institutional products in Kansas City. So we had a special MA plan in on the Kansas side of Kansas City that basically when a nursing home contracted with United Healthcare, they got a nurse practitioner and put in a nursing home to help be the liaison between the client and the medical director. So the facility got a free nurse practitioner, and they would do charting, they would do updates, work with the staff, yada yada. It was a good product. But a lot of the staff, i.e., the admin team and the claims team, hated it because with original Medicare, someone comes in from the hospital, oh, you're going to get this therapy. One phone call does it all, right? I call Medicare, I get my authorization, they're good. Pretty much need one off most of the times. Medicare Advantage, I got a 3-day authorization. They have to call in with progress. So it created a lot of workload for the skilled nursing facilities. Remember, for most clients, skilled nursing is temporary, right? Not a lot of people go to skilled nursing. Hopefully, your clients don't, because that means they had a bad injury and they're not ready to go home yet. They got to go get therapy and a higher acuity of care prior to being discharged home. So skilled nursing facilities don't like MA plans because it's not the normal procedures for authorizations. That's it, right? There are some rug rates, which are basically the codes that they use to get paid that are different. But the team that calls in the authorizations are the ones that are going to be like, I hate this. And a good friend of mine back in Columbia, Missouri, well, because I'm in Indianapolis right now, she is actually a discharge planner for a hospital, and she thinks MA plans are the devil because of that, because it's not a simple Medicare procedure or protocol. It is an insurance protocol that can change per provider, right? I got a 3-day off, I got a 4-day off, I got to call in this person, get transferred this person, get transferred this person. It creates a living nightmare for her. So yeah, the only thing you could say is, you know what? How many times you go to skilled nursing? Once, maybe once in your life. So one moment of inconvenience, is that worth having monthly affordability? I don't know. Maybe it is, maybe it isn't. And if the skilled nursing facilities are gonna complain, but their residents got better care. And they knew that. So it's funny because they would yell at me all the time, like, we hate the pre-auth process, but the nurse practitioner I worked with the most was named Kim. She was awesome. We love Kim. We hate your authorization process. So you're lucky we love Kim, because otherwise we just kick you out. And I'm just a sales guy. So I agree with you. It stinks. I have no control over it. Thank goodness Kim is a fantastic nurse practitioner and has a personality and is great to work with. So that overcame it. So when it comes to skilled nursing facilities, say, look, I understand that's a friction point with these plans, but it's a small friction point, especially when you're saving $300 a month on versus that. So, buy them donuts. I don't know. So to say, hey, I know it stinks, but here are the benefits of having it. They have a hospital indemnity plan, it offsets this, blah, 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 blah. And just, you're in the same boat with the skilled nursing facility, remember. You're not the insurance company. You sold the insurance, but you're not the insurance company. So put yourself on their side, right? Don't put yourself on the insurance carrier side, because most people don't like insurance carriers. Fun fact, or not fun fact, but fun thing to do. Go to Facebook and look up the insurance carriers and read the comments. Oh, there's one of the main reasons insurance carriers don't post a lot on Facebook and social media, because the comments. I had a claim last year and you denied it. They just people just rip them apart online because they can. So yeah, put yourself on the side of the skilled nursing and the client and say, yes, I agree. This is horrible. If I could change it, I would. I'd make this so easy for you, but I don't have that power. So let me talk to my carrier rep and see if there's anything we could do, maybe grease the wheels and yeah, be on their side. So there you go. So I've got some more comments. Let me get in here. Dun, 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 MOOP depends on the policy. Exactly. Yeah, MOOP is all over the place. Like, you can go to Las Vegas, Indianapolis, Los Angeles, Dallas, Miami-Dade County. You're going to have all different MOOPs, right? Even with the same carrier. So a Sharp MA or MG rep. I don't know what MG rep is. Medicare Mike Gatorna rep, because that's my initials. Always knows better for the client. Yeah, MA is always less when you compare the co-pays and deductibles to the annual premium cost of Medicare G plan. And again, a lot of it is the comfort level of your clients. Am I comfortable just having one premium and have nothing out of pocket after that for the most part? Or do I want to follow a network and just pay as I go? So again, to each your own. Fun fact, I'll tell another quick story. I remember I was in Prairie Village, Kansas, at an appointment with three women, right? I thought it was one, two friends showed up. So you always assume, or the stigmatism with Medicare Advantage is for lower income individuals because it's zero premium. They all bought policies from me. Two bought Med Supps. One who I judged by the comments she was making and just in conversation, I judged to be the one that was most well off, like going on trips, going on cruises, blah, blah, blah. She bought a Med Advantage because she's like, I'd rather keep my money and pay as I go than pay every month if I need it or not. Her other friends are like, I can afford the Med Advantage or Med Sup. I just want that. I just want to pay a premium and forget about it. The other one's like, nope, I want my money. I don't want to give anyone my money that doesn't need it. So you never know. Again, there are very well off people that have Med Advantage. There are people struggling to afford the Med Subs. So it's all over the place on that. Different folks, different strokes. Exactly, Amanda. I agree 100%. And it's not our job to judge. It's our job to offer options. Is there a way for a client to report to CMS all the agents calling them during the Medicare? Remember, when you call Medicare, you're not calling Medicare. You're calling a TPA, third party administrator. So you're calling someone following a call script. Now, the challenge is a lot of these people may have filled out a form like 6 months ago and they forgot about it or they didn't realize what it was and they gave them permission to call and it's chaos. So it's very hard to prove and it's very labor intensive. So you could call and report it, but again, you're calling a TPA, third party administrator. CMS contracts out all their call centers. I forgot the name of the company. It used to be General Dynamics, the defense contractor. It's someone else now, but they're not CMS. They're a third party. They have to log the complaints, but then it's like, yeah, you complain, you hate that, yeah, great. And remember, when you're an insurance agent calling in, it's not as good as the client calling in. Like little sweet little Sally, who's 80 years old, her calling in is a lot more weight than middle-aged white man Mike. So yeah, that's just angry that someone's calling his clients. But yeah, they can call it. It's just 1-800 Medicare. Are all those with group plans also comfortable with all the PA requirements? PA requirements. What are PA requirements? You know, Christina? Pre-authorization
Yeah,
requirements.
pre-authorization.
Yeah. And that's the thing. Group insurance, all different set of rules, regulations,
Yeah,
right? Group
prior
insurance is its
authorization.
own chaotic mess. And here's the thing. How many people do you know under 65 go to a skilled nursing facility? Not a lot. But if you Google pre-authorization headaches or pre-authorization issues, there's endless supplies of them, right? Especially when I've always heard like there's a famous story. I don't know if it's true, but it's a nice feel-good story where I guess some veteran had a wheelchair that was breaking, like an electric chair or something, and he couldn't get his insurance company to pay for it. But he was at Home Depot and they fixed it for him for free. Feel-good story, right? So yeah, it happens everywhere. It's just the senior market is what we're attuned to because I am senior market. Am I only a senior market for the most part? Yeah. Christina does ACA. Actually, she's on this side of me. She does ACA. I don't want to do ACA. I just learned again. I joke. I just learned how to spell it yesterday. So, what happens when there's no longer an MAPD plan in the county or it's not commissionable? Then what do you suggest? Well, if it's no longer available, can't sell it. Then you have to go to a different MA plan, or if they're losing their plan, remember it opens up a guaranteed issue time for their med sup. So you just pivot to Sup and say, here are the premiums, or we could go to this different MA plan. If there's no MA plan, you go original Medicare, maybe high deductible G. Let's give you original Medicare with a stop loss, right? So those are your options. Med Sup, high deductible Sup with a stop loss, basically, or a different MA plan. If it's not commissionable, congratulations on getting to do community service. But your hospital and MA plan is your savior. So there's your fix. Trial period makes me nervous. Yeah, makes me nervous too because it only works if it's their first election. If you got someone that's 70, and like, yeah, I've changed plans several different times. I don't think I had a Medicare Advantage plan ever. Ooh, that's a tough one because if they had one and forgot, their trial right's over. So I only did it when I knew for sure, like they're 66 years old, on Medicare for a year, and I sold them the Med Sup. It's like, then we could try it because I know we're safe. But if you got a new client that's in their 70s and they don't remember, I would not roll the dice on that, right? I'd just like, look, we could try it, but if you've ever had one in the past, what I just told you is null and void. And I don't know how to look that up. I don't think anyone else does either. So that Sans calling all the companies, and they won't give me the information for HIPAA rules, more than likely. So it's a heck of a dice to play. So only if you're 100% certain they've never had a Medicare Advantage plan prior. Oh, MG equals Medigap. Okay, that makes sense. Yes, Medigap. I forget. I say Med. I always say the last two companies I work for was MS, Med Sup. So MG, Medgap makes sense. Everyone's Puma. Please use more acronyms. That's our industry. All right. So, any other questions, comments, concerns, threats, promises? Please let me know. Always happy to help. Christina, what do you think?
Oh, you might have, I did find something. Hold, please. Okay. So, believe it or not, specialty agencies began offering policies to protect against alien abductions in 1987.
Are they
Is
still available?
it says yeah.
Okay. So Christina's job for next week is to tell us a little bit about alien abduction insurance. I'm assuming you mean extraterrestrials,
Yes, that's what
like
it says.
little
Yeah.
green or gray men.
Uh-huh. Yep. Okay, I'll
Okay.
find some more